right? That means more sodium will get back into the body, return into the body, more water will be taken into the body, right? So more aldosterone will increase the water in the body. Is it clear? And sodium in the body. That means what? Blood volume will go up. Blood pressure will go up. Make sense? So aldosterone increases the water, increases the blood volume, increases the blood pressure. Make sense? Good. Okay. Another hormone that comes from the pituitary gland, which is the master gland located in the brain, and that hormone is called antidiuretic hormone, or ADH. Comes from which gland? Pituitary. And works on collecting tubule. Works on the collecting tubule. And this hormone has very strong action. It reabsorbs plenty of water. A lot of water. That means a lot of water is taken back by the antidiuretic hormone. ADH comes from where?
Pituitary.
Pituitary. Pituitary is located where?
In the brain.
In the brain. Make sense? Okay. Now same thing, same question. If I ask you more ADH, if more ADH is released, then more reabsorption of
More reabsorption of
water. That will increase the blood volume, right? Now what will happen in urine volume? Now you tell me. If more ADH is released, water will be taken into the body, right? More. That means what?
Urine will be more concentrated.
Urine will be more. Makes sense, right? Because from the tubule, I said you that anything remains inside the tubule will get out as urine, right? So if water is taken out from the tubule, going back to the body, right? So inside the tubule, water will be less. Make sense? So the urine volume will be
Lower.
less. Urine will be what? Concentrated or diluted? Concentrated, right? Small amount means concentrated urine. Is it clear? Okay. Now you tell me, opposite. There is a clinical condition in which the tumor, most of the cases, tumor of the pituitary gland destroys the pituitary. So ADH will not be released. Make sense? Because pituitary releases ADH, right? So if pituitary tumor destroys the pituitary, ADH will not be released. Make sense? So no water reabsorption. Make sense? Water will stay inside. Will get out with the urine. Is it clear? So urine will be what? Concentrated or diluted? Volume of urine will be what? More or less? Very high, right? Volume. Because water is not getting back into the body. It is staying there due to lack of ADH. Is it clear? So that person will do what?
Urinate more.
Urinate more. Will run to the bathroom, right? PA more. And that is called what? The clinical condition that is called diabetes insipidus. Insipidus. Okay? Diabetes insipidus. It is not related to insulin, right? It is related to pituitary hormone ADH. It's totally different. It's not insulin or sugar. Just the volume of urine production is more. Is it clear? So due to pituitary, not due to pancreas. Okay. So diabetes insipidus. The person will frequently pee and produce plenty of urine. Okay, so I'll ask all these in your exam, okay? Now you tell me, if diabetes insipidus happens, body will suffer from what?
Dehydration.
Dehydration. Make sense? Because your body is losing water, right? Water is getting out from the body. So the person will quickly get dehydrated, right? So that is a problem. Okay. So two hormones, remember, and both have very similar action. Aldosterone comes from adrenal gland and reabsorbs sodium and water in the proximal convoluted tubule, and antidiuretic hormone comes from which gland? Pituitary, and reabsorbs plenty of water. Okay. Now, the amount of urine is regulated by these two hormones. That means the last part of the nephron is sensitive to those two hormones, and regulation of urine volume is done by this part, not this part. This part is fixed because no hormonal action here. It's fixed. Okay. Good. Okay. Nephritis, also called glomerulonephritis. You already know, itis, inflammation of nephron, right? So, if the inflammation of nephron occurs, that is called nephritis, or glomerulo, because glomerulus is here, right? This is the glomerulus, the tuft or ball of capillary. This one can also be, inflammation can happen. So glomerulonephritis. And it could be chronic and acute. Acute will appear quickly, usually due to hepatitis, strep throat, another is strep throat, hepatitis, another condition that also causes that, AIDS also can do that. Another is lupus. So, if someone suffers from this, that can also cause nephritis. Okay, so the microorganism from those organs can go to the kidneys and cause infection and inflammation of the nephrons, and that is nephritis. Okay. There are a few other conditions. Chronic nephritis is more related to autoimmune. Disease. In your body, antibodies are produced, and that will cause inflammation of the nephrons. Okay. Now, there are some clinical conditions related to the urine. Anuria. A indicates absence. Okay. A indicates what? Absence. Okay. So anuria is stopped urine production. The kidneys have stopped producing urine, which is good or bad? Very bad, right? You know that kidneys through the urine excrete the toxic chemicals. We have talked about the functions, right? So if anuria occurs, that means that condition is really severe. Kidney failure, like acute kidney failure. If someone suddenly both kidneys got non-functional, that will cause anuria. If the normal amount of urine production is 1 to 2 liters per day. Okay. Now, if the volume, that means 1000 to 2000 milliliter, right? Milliliter. Now, if the amount of urine production goes below 100 milliliter per day, that means almost no urine production, right? Per day, like only 100 milliliter. So, if below that, that is considered as anuria, no urine production. Another condition that is called oliguria. Oliguria indicates small amount of urine production, very small. Okay. If the urine production goes below 500 milliliter, normally your kidneys should produce 1 to 2 liters. That means 1000 milliliter to 2000 milliliter. Now, if it goes below 500 milliliter per day, that is considered as oliguria, decreased production of urine. Another is called hematuria. You tell me, hema indicates what? Blood. Okay? Hematoma. Remember we talked about hematoma, hemorrhoid. So hema indicates blood. So if in your urine, blood should not get out through the urine. We know that, right? Blood should not get out. But in nephritis, sometimes we see if infection occurs, some blood cells, red blood cells, can easily get out from the blood and enter into the urine. And that is called hematuria. Blood in urine. It is very easy. You can take a drop of urine and see under the microscope, right? Put on the slide and see under the microscope. You will see intact red blood cells are there. So if you see that, you often see red blood cells. So that is hematuria. Hemoglobinuria. Very similar. If hemoglobin, the breakdown product of RBC, that means hemoglobin is present in the urine, that is hemoglobinuria. You know, red blood cells contain hemoglobin. So breakdown of red blood cell will cause hemoglobinuria. And another is called pyuria. Pus in urine. Dead cells of the body, right? Dead tissue produces pus. Pyuria. Albuminuria. These are easy terms. Albuminuria. Similar is proteinuria. Albumin is one type of protein, you know, plasma protein, albumin, globulin, fibrinogen, you have learned that. So if in urine, albumin type protein is present, that is called albuminuria. Proteinuria. We use all these terms. Proteins, other proteins in the urine, okay? So if specifically albumin is present, we say albuminuria. All these are abnormal. We don't want any blood or hemoglobin or pus. Pus indicates there is some infection, right? So the pus somewhere in the urinary tract or kidney, infection is there. That's why the pus is coming out through the urine. Okay. If you see the red blood cell, that means what? Filtration. something is wrong in the filter. Okay, so that's why the red blood cell is getting out. So the holes are big. So something is wrong. All these indicates the problem in the urinary system, the kidney or the urinary tract. Polyuria. This is also makes sense. Poly means multiple, right? Poly means multiple. The person will frequently urinate. That is polyuria. Make sense? Frequently urinate. So those are some conditions we use in kidney related disorders and the urine. So let's stop here.